Good morning, everyone. It is 7:28, and it's time to start living well. And we have a good friend of ours joining us in studio right now. Corey DeBerg from Grand Jivante is here to talk about something, honestly, you really need to pay attention because if you have a senior person in your life and they need some medical care, this is going to be very important information.
Absolutely. As we're talking about living well in 2019, Corey DeBerg, we're very excited to have you here and talking about not only Grand Jivante as being a wonderful location that is there to take care of seniors, but some things maybe we don't always think about in case they do need some extra assistance when it comes to medical care.
Correct. So, we are a long-term care facility by the core of our business, but one of the things that we really do that most people don't know is rehab care. So, rehab care is totally different than long-term care. Rehab care is after you've had a surgery, a hip surgery, knee surgery, shoulder, had a spinal cord injury, replacement, back surgery, any of those things, or if you had a fall, you can come to a nursing home, you can come to us, and we provide short-term rehab to get you back to your current level of functioning so you can go back home.
I didn't realize you did that.
Yes, we do.
Now, is this something where you would stay at Grand Jivante, or you come to do basically your physical therapy type stuff?
So rehab stays are all inpatient stays.
Oh, they are?
So, yep. Okay. So it's not like you go to a clinic, you go there for, therapy for a half hour and go back home.
Right.
This rehab stays combine physical therapy, occupational therapy, and then nursing care as well.
Wow.
So,
and what's the average stay for something like this?
So the average stay is, obviously vary depending on the condition.
Right.
A stroke might be a little bit different than a spinal cord injury.
Right.
So the average stay probably in Iowa right now is under 20 days.
Okay.
So it's not like a long-term care stay where you're there, 14, 18 months. This is you're in, you're out, you're there to recover and go back home.
But this is getting the absolute best care possible.
That is correct. You don't want to go home after a surgery, for example, if you've had hip or knee surgery or any of those surgeries, and maybe you're okay, you think you're okay to go home, you get home when you fall again, and then you're starting that process all over.
All over again.
Yeah.
You want to make sure you're your best you when you go back to the normal life, so to speak. So, so realizing that this care is provided, who's paying for this? Because it is different from the other services that you provide.
So it kind of varies again too. A lot of it varies. So if you're over the age of 62, everybody has Medicare if you're over 62 or a Medicare Advantage plan.
Okay.
So Medicare will pay for the first 20 days 100% covered.
They will?
Yes.
Wow.
So you don't have any bills.
I never knew that.
So you don't have any bills for the first 20 days. If you're there under 20 days, Medicare will take care of the whole bill.
Wow.
And as you said, the average, depending on obviously the situation, is about 20 days.
Correct.
Okay.
So then if you go over 20 days, then your co-insurance will kick in. So then maybe Medicare will pay 80%, and then your other insurance company will pay the remaining percent.
Okay.
Now, then it also varies too, because if you get past maybe 40 days, and Medicare might say, we're done paying altogether because we think you've reached your highest potential, then it's back to you as an individual.
Okay.
So 20 days, are going to be free as long as you're showing improvement. If you go to one of these facilities and you think you're going to get 20 free days just by laying in a bed, that's not true. Medicare makes sure that you are showing improvement, working hard with therapy to get better.
You have to work it.
You have to work it.
It's not just a little vacay hanging out in a beautiful space.
Correct.
You got to improve.
But you did say there's one thing that's really important that you have to make sure that is taken care of when you're first getting your initial service, right?
Yep. So if you've fallen or if you have surgery and you go to the hospital, the big one here is, especially if you've fallen or have gone to the hospital, by ambulance, and you get there, there's two different statuses the hospital will put you on, and this is for any hospital, whether you're rural or if you're urban, is if you go in there, maybe you've had a chest pain, you've rushed by ambulance to the hospital, and they put you as observation status because they don't quite know what's wrong yet.
Okay.
So you've been there now for 3 or 4 days, and you're still pretty weak, and you want to go maybe back to a rehab facility to get some strength training. If you've been on observation status the whole time, Medicare will not pay a penny of it. If you are in admitted status, so if you've gone to the hospital and they admit you, then Medicare will pay. So even though you might be in the hospital for 3 or 4 days on either status, only the admitted status will actually Medicare benefits kick in.
So when you're going to the hospital for the procedure or whatever might happen, you have to make sure it's done a certain way so then you're covered on the back end for rehab.
So you want to make sure if you are there, your loved one's there, you want to make sure that you are on admitted status versus observation stay.
Okay.
So if you get to the hospital and you realize you're going to be having a procedure performed that will require some extra therapy when you get done with having the procedure, you have to make sure that you are plugged in like that.
Correct. And the big one here is normally if you have a surgery, they're going to know to put you on admitted status. But if you've had the fall or you're kind of rushed to the hospital and they don't quite know what's wrong with you yet, they'll put you in observation just to kind of observe you to see what's going on. But if you've been there for 3 or 4 days and want to go back now to get stronger, you won't have any Medicare coverage, which goes back to your previous statement that now you as a consumer are liable for the whole bill.
Hey, that's an important thing to know. Yeah. Okay, so let's go back to the great services that you provide as being a rehab facility. What are some of the things that you're going to be providing if so people can get back to their best themselves? You know?
No matter what the service is, no matter what you're there for, so the shoulder replacement, the knee replacement, the spinal cord, COPD, chronic heart failure, any of those conditions, you're going to have a physical and occupational therapist working with you. The physical therapist will be trying to provide you more strength. So if you have a shoulder replacement, it's making sure that shoulder muscle gets strong.
Okay.
The occupational therapist will be there to actually assist you in your daily living. So like, how do you get your shoulder muscle to actually put your arm through a sleeve to get dressed?
Okay.
Maybe your muscle is strong, but if you have a new muscle in there, you need to train it to actually put on that shirt in the morning. So you're not calling your loved one saying, hey, I need
help me get dressed.
Help me get dressed.
Exactly.
Just so the physical therapy is aimed at making you stronger, where occupational therapy is going to be more of functioning in your home, functioning in life, getting those muscles to do that, brushing the teeth, combing the hair, whatever it may be.
To get you back to somewhat of a normal routine.
That is correct.
So, but how many hours a day of therapy would that be?
So that's going to depend. Again, another one of those depends. So it will probably range between 30 minutes and 3 hours, depending on your condition.
Okay.
So if you're there just for light rehab, just to kind of get you, maybe you're not as sick or don't have as much pain or don't have as many things wrong, or many ailments, 30 minutes a day might be enough. If you're there after, a 2 hip replacement, you're probably going to be at 3 hours a day, trying to get you back to walking, back to functioning at a higher level.
So what I'm hearing is it's just very personalized.
It's very personalized.
To exactly what you need.
And if, every person's different too. So, your pain tolerance might be a lot different than Jackie's pain tolerance.
Absolutely.
So maybe Jackie can handle 3 hours a day, but Lou can only handle 15 minutes.
12 minutes.
Yes, yeah.
No, but seriously, having experts like this help you getting through the physical part and the occupational part, you are going to recover a lot quicker, won't you?
Yep. And that's kind of the goal is maybe you don't, think you need to go to rehab afterwards and you can go straight home. But if you look at data, it'll show that you'll have more likely for a fall or eventually you'll come to a rehab facility or long-term care. So the goal is to get you back to your highest level of functioning so that you can stay at home and be as independent as possible.
Now you have a document that people can get a hold of which really has some good tips on it, right?
Yep. So if you go to our website, grandjivante.com, we have a document called 11 Things to Know Before Rehab Care. And it walks you through kind of the questions we talked about today is, who qualifies, the insurance questions, what kind of therapies we all offer, questions to ask your discharge plan or your social worker at the rehab center, options, for you after rehab if you can't quite make it back home, or what happens if you stay to day 60 or day 80, what happens in those situations.
Really quick question I have, as you mentioned, it's important to know how you're admitted when you go to the hospital to make sure you are covered, but then afterwards, can you choose where that rehab is happening?
Yep, so good question. That's going to, again, depend. So at the end of the day, it's always about patient right. So if you live in Des Moines and you want to go to a certain rehab center, you absolutely have that option.
Okay.
But again, if you have gone to, let's say Mercy, and your doctor wants you to go to a rehab facility, he may have, a contract with that facility, so may steer you towards one way. A lot of hospitals are going to have those partnerships with nursing homes, rehab centers, just to be aware of that. Nothing wrong with that, but if you don't like what your doctor recommends, you can certainly go somewhere else.
You have a choice as the patient.
You do have a
choice.
You
do have a choice.
Yes. Now, kind of back to that though, is again, who pays for it? It always comes down to who's paying for what. Is if you go to a different facility, you got to make sure they accept all the Medicare plans, Medicare Advantage plans, all the insurance plans. Because maybe if you want to go to a certain facility, that's fine. But if they don't take your insurance, now you'll be stuck with a $16,000 bill.
That can be another issue.
They can just call you and get a hold of you to find out all the details.
Yep.
Okay.
So they can always call us, and at any other facility too. You can always reach out to them to figure out what plans they take, what insurances they take.
Well, remind us your website, because again, you have a document people can check that anybody should read if they're getting ready to go into a rehab situation. So go check out that document and go check out Grand Jivante. Always doing great work to make sure we're taking care of our seniors the best way possible, and now learning about senior rehab care as well. So again, give us that website.
So you can go to www.grandjivante.com, and it's right on the top page of the home page. It's the documents right there. A simple download, and it'll be on your desktop.
Otherwise, give these guys a call, lifeunlimited@grandjivante.com. You can send them an email. They'd be happy to answer any of your questions.
Wonderful.
Thank you for joining us
Thanks for
this
being here.
morning.
Thank
Great
you.
to see you.
You as well. Thank you, guys.
All right, 7:39 right now.